So, since you've started working with cystic fibrosis kids, have you noticed like a big change in the way that you treat them? Like you give them medicine or you take care of them or anything?
Yeah, that's a great question. So a lot of the medications that we use commonly, like there's one called Pomozyme, which is a chemical that you breathe in as a breathing treatment, and it breaks up DNA that's in the mucus. So it makes the mucus a lot less sticky. That wasn't even around, or it was just getting started when I came out of medical school. And then a lot of the enzymes have gotten better and better, and a lot of the breathing treatments have gotten better. And then there's this new drug called Kalydeco, which is helping that 4% of patients I told you about. That's like brand new. That's like less than 2 years old. So the medications have gotten better, and the knowledge about cystic fibrosis has gotten better. And as a result, people with cystic fibrosis are definitely living longer, way more productive, way more healthy, feeling better. It's still a serious disease because if you blow it off, then people get sicker and sicker and sicker. But the medications are better, we understand the disease better, and people are living longer, happier lives. So it's definitely pretty cool.
Okay.
And do you ever like change treatments partway through a patient's like life?
Oh yeah. So we constantly change. So it's sort of like what we want to do is we want to make sure that the treatment is right for that specific patient. And sometimes, like, you could have two brothers with cystic fibrosis, and they're not on exactly the same medication. Some people, we put more emphasis on their GI, intestinal, digestive stuff, and some people we focus more on their lungs, and some people it's a little bit of both. And so we definitely want to personalize it, and then over time, as the patient's needs change, and what they needed when they were 7 years old is different than when they're 17 years old. We just make it right for them at that point. So we definitely want to adjust and readjust. And then, it's sort of like if you're on a baseball team or a football team, you don't play every game exactly the same, right? You look at your opposition, you look at maybe the weather conditions or whatever, and you're going to try and optimize everything for that specific game. So part of the thing that we do in Cystic Fibrosis Clinic when we meet with the families is we say, okay, well, this is how we used to do it over the last few years, but now I have some new ideas to think about how we can make you even better going forward. So it sort of depends on the patient, it depends on the technology, it depends on the medications, depends on how the patient's doing. We really want to focus on their needs and make adjustments.
And then another question on that 4%
Yeah.
that are being helped a lot. What's really happening? Like, is it taking the mucus and like thinning it out, or what's changing about it, which makes it not a big impact on their lives?
Yeah. So this is getting into more physiology. That's a great question. So, did you guys already do cell biology, like the DNA and then RNA and protein synthesis?
We kind of did a
bit.
few years, like
Yeah.
Okay.
Yeah.
So your question is, how are the new medications working? So the old medications were about, hey, if your digestion isn't working because your body doesn't produce an enzyme, let's give you the enzyme. Let's replace what you're missing. If your mucus is too thick, let's thin it out so you can cough it out. If you have a hard time coughing, let's vibrate your chest so that you can cough things out, like keeping the lungs nice and clear. If you have an infection, let's give you antibiotics. The genetics is changing everything, okay? So I'm going to go back to your cell biology. It starts with the DNA. The DNA has the code for how your body's supposed to work. And then DNA gets transferred to, the information gets transferred to RNA, and RNA leads to something called protein synthesis, which is your factory inside your cell, and the factory builds something, whether it's skin cells or teeth cells or eyeball cells. In this case, in cystic fibrosis, it has to build a little tube that's sort of a machine for getting salt in and out of the cell. So it's building basically this doorway that allows salt and fluid to pass through. The new medications are looking at the genetics and they say, hey, you know, this kid's problem is the DNA is not talking to the RNA. Let's find a medication that will get them to talk to each other. Because once they talk to each other, the whole machinery works fine. Or let's say you have another girl and her problem is the DNA works well, the RNA works well, but the protein that's being produced to do the work, it's not working. Let's get a medication that will tweak the production thing. Hey, this boy, the DNA works great, the RNA works great, the protein production is great, but there's a problem with delivering the protein, the machine, to the surface of the cell to make everything work. Maybe we need a medication to help with delivery, okay? And then there's other ones where, like, let's say it gets delivered, the protein gets delivered, but it doesn't work. But some people are saying, you know, there's this other protein, it's not supposed to be the main protein, but we have a drug that's going to ramp that guy up. It's going to open the doors, make that machine work faster. So we don't care if the main machine doesn't work. We have a drug that's going to turn on another machine so that the patient doesn't even feel like cystic fibrosis. So what genetics has done is it's given us an idea to say, you know, all the kids with cystic fibrosis are not exactly the same. And so we should target the medication for what their specific problem is. And right now, this one, it's called Kalydeco, it works in a specific way, but that's not going to work for everybody else because everybody else doesn't have that same exact problem. Right now, it only works for about 4% of people. So they're looking at other drugs to say, well, let's get a drug that's going to work on another 12% of people. Or, hey, this, you know, the real big one is most people with cystic fibrosis, probably about 80 to 85% of people with cystic fibrosis have the same gene. And if the scientists and doctors can figure out how to fix that gene or fix the problem with that gene, then 85% of the people will feel way better. So that's our hope, and I think there's a lot of research that's in the pipeline. There's a lot of really nerdy people who love doing this stuff. They want to help people, but they really love the science too. And they're trying to find ways to fix either the genetics of it or the protein production of it, or even bypassing the whole system and trying to open up another machine, it's called a cystic fibrosis tube or channel, to get that to work. And so even if the main guy doesn't work, let's turn something else on. It's almost like opening up a detour to make things work.
And then, so like typical CF, when you have it, like the airways, for example, like how it like clogs up, like the mucus clogs it up in like normal airways, and like lubricates it and like makes it easier to breathe.
Yeah.
Is that the DNA not going in, or the RNA not taking the DNA, or what is?
Yeah, so there's a variety of reasons why the mucus is thicker and stickier, but the main bottom line is the cell, on the surface of the cell, there's supposed to be a tube, and that tube is supposed to allow salt to pass back and forth.
So it just goes back to the salt?
It goes back to the salt. And when the salt doesn't pass back and forth, it turns out that water doesn't pass back and forth either. It's sort of an osmosis thing. I don't know how deep you want to get into there, but basically if this chamber is salty and this chamber is less salty, then fluid will want to go over there to the salty part to dilute things out. Remember that part? And so if the salt is not traveling the way it's supposed to, then it turns out that water doesn't travel either. And the end result is that the mucus is supposed to have a certain amount of wateriness to make it thin and easy to cough out. Patients with cystic fibrosis, their mucus is thicker, stickier. And so when they get sick with a cold, they're producing mucus just like everybody else, but it's thicker and stickier. And they have to work harder to cough it out. And it turns out we all have mucus in our lungs every day, normally. But if you have everyday mucus that's thicker and stickier, you have to work hard to get it out. Otherwise, what happens is we have millions of these tubes, and they're tiny, 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 Well, if you stick a cork in there, a cork of mucus in there, after a while that tube is just going to shut down. So the idea is to keep it uncorked, keep it open, and keep the air flowing in and out.
Okay. Thank you.